What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am, as always, your host, Dr. Meghna Dassani. Today, I have the pleasure of chatting with, this is actually our first guest episode for 2025, and I could not have asked for a better guest to open with. So our guest today is Karese Laguerre. I tried to practice her name. If I've butchered it, please forgive me, Karese. Welcome to the show.
Thank you so much for having me. You got it perfect.
Oh, I try. Karese is a registered dental hygienist, but you're not practicing anymore. Is that correct?
No, no longer clinical hygiene.
Yeah, but I know as a myofunctional therapist, that keeps her super, super busy. She founded the Myo Spot, which is a practice that is aimed at amplifying oral wellness, incorporating whole body wellness. And I love this. Through teletherapy, she helps clients of all ages. So if you're a listener and has been looking for a myofunctional therapist, I know I get these questions all day long, or even a doctor that's listening in, she's your girl. And she helps patients, providers with tongue ties, TMJ disorders, speech, sleep, grinding, the whole spectrum of what we could ask for our myofunctional therapist to help us with. What I really am excited to get into and share before I forget is she is also an accomplished published author. Her book is actually called Accomplished: How to Sleep Better, Eliminate Burnout, and Execute Goals. And we will dive into that. But for our listeners, make sure you get on Amazon. I know she has the book on Amazon, and I think it's a great resource for parents that may be looking for, what do I have that I can help my kiddos with. She's also a global traveler. She has quite the travel bug, and I know she spends time traveling with her husband and her children. So welcome to the show, Karese. How are you?
I am great. I am great.
What an honor to have you here. I am so excited. Thank you for taking time out. I'm going to jump right in because I am curious. What prompted the change? What prompted not practicing hygiene clinically, chairside, as you mentioned, to becoming a thought leader in myofunctional therapy? And I want to know, how has this journey shaped your approach? Tell me everything, spill.
Yes, I am very excited to share that it was just in being a mom that I came across myofunctional therapy and Airway and all the beautiful things. Like you mentioned, I have 4 children, and I like to say that as parents, we always give the highlight reels. Like if somebody is going to ask us, how's everything? How are the kids? This one's in soccer. We've got recital. Like we're
Yeah.
sharing all the good stuff. But there's always like this underbelly of things that are going on that sometimes we're just not sharing because it's just not the pretty stuff, right? So in my household years ago, I have one boy. He's the oldest. My son had a lot of issues with behavior and impulse control. Focus was always a thing. I remember from when he was in kindergarten, the teacher would tell me that he could not focus or pay attention. And I'm like, but he's 5, lady. Like,
Leave
I
him
don't think
alone.
any of the 5-year-olds are paying attention. We played that game for a while, all the way
Right.
through like 4th grade, until he was officially diagnosed with ADHD. And I'll come back to that story a little later. But
Mhm.
my daughters, so I have 3 girls. My oldest daughter had every sleep issue under the sun. I mean, you name it, we had it every single night. It was bedwetting all the way through till she was 10. I remember complaining to the pediatrician. The pediatrician was like, yeah, she won't be like 15 and still doing that. She'll grow out of it. But like, tell my washing machine that, like, tell my water bill that I'm washing things every single night. My younger 2 daughters were very, very similar. We had difficulties with breastfeeding for both of them, upper airway, all sort of congestion, ear infection, throat infection, ear infection, throat infection. It was like chronic, nonstop. We couldn't get it out of the household. And between all of them and all their various things, it took a pediatric dentist who I was working with at that time to really highlight for me that like none of these things although it's very common, none of it was normal. And all of it really stemmed back into how they were using all of their oral facial muscles and like how they were developing. And I was just astounded that I didn't hear about this. Like, where was this in hygiene school? And I went to a really good school. I went to the University of Medicine and Dentistry in New Jersey. We had a phenomenal program. We were doing rotations through the dental school, and not once was this mentioned. And these were things that were going on just in the underbelly of my home. So really, once I was able to start putting those pieces together, and it really, really like jump started with my son, because I remember after learning all of this with the pediatric dentist, I went to my next follow-up appointment. We had him on medication and various medications because none of the medications were really helping for a year and a half. And we went to our next follow-up appointment with our pediatric neurologist, top one in New Jersey. She was phenomenal. But as I'm talking to her and telling her that the medications aren't working and I'm really looking to go a different route and I want to look into his sleep, immediately she just stops me like mid-sentence and is like, "What? You never told me he had any problems with sleep." I mean, I just want to let everybody know that I was never asked, but that's neither here nor there.
Yes.
Then she just explained to me voluntarily. So I didn't even get to explain to her what I had learned. She explained to me voluntarily that there's a 70% overlap in the manifestations of ADHD because it's a symptom-based diagnosis. It's not something that you get blood work for, no CBCT, MRI, like none of that. 70% overlap between those symptoms and the symptoms of those of children who are sleep deprived. And I couldn't believe it. Like, I was never asked about his sleep. Nobody ever put those pieces together. And this is a specialist who knew this. And we had just been medicating for so long. But I like to say that after I left that office and moved forward with all of the airway stuff that we needed and really dove deep into Myo, I met my son for the very first time at the age of 13. And like, I feel like I should have done this so much sooner, right? And it's just this gripping thought that there's so many parents and so many people out there who have not gotten to meet their children for the very first time, despite the fact that the children are running around. They haven't gotten to meet them. And so that's what really fuels my fire, is like helping other people push through and helping other families really be reunited, because you're not with your actual family until we get over the hump of these issues.
Oh, that gave me goosebumps when you said you got to meet your child for the first time when he was 13. I can't tell you how many parents are going to resonate with this because they're like, oh my gosh, yes, I know my child is somewhere under there. So thank you for that. What are some of the biggest myths or misconceptions about myofunctional therapy that you see on a daily basis, be it from parents, be it from providers, and how do you address it? What is it that people don't know or have questions or concerns about?
I love this question. There are a lot of misconceptions, so many. I'll just narrow it down to like the biggest one. But the big thing, you Google myofunctional therapy, first thing that's going to pop up are exercises. You might find them on YouTube, you might find them in some sort of like blog post or whatever. You'll find just exercises. Myofunctional therapy is so much more than exercises. And so when we think of myofunctional therapy, I want people to think of it as like a therapeutic process, because really what we're trying to do is we're trying to change the way that those muscles interact. And that's on like a habitual basis. We want to establish a new neurocognitive like awareness in these muscles. And so it's a program of a three-phase sequence, really. And that first step, yes, exercises. Like, we are isolating things. We're typically trying to get to eliminating any sort of overdeveloped muscles, underdeveloped muscles, trying to establish some symmetry and so forth. But then we've got to take it to the next step. And that's what the internet is never talking about. But the next step is like coordination of those muscles. How do those muscles work together? How can we get the muscles to establish a better pattern? That last step, habituation, integrating it into daily life, is where the autonomy, and that's the beauty of myofunctional therapy. The purpose of myofunctional therapy is not to be dependent or reliant upon your myofunctional therapist for the rest of your life. It is so that you can get that autonomy of your health, so that you are able and capable to be a freestanding person who is able to own their musculature. And so I think the biggest misconception is that it is just like a set of exercises and, you know, you just do a couple of things and then bada bing, bada boom, you're there. And that's not the way that that works at all in any capacity. I think the other misconception is that it's like this overarching resolution for all things. And it's really not. It's absolutely wonderful and magical. And it did contribute to me getting to meet my children for the first time. But it's not the only thing that we had to do. We had to work with interdisciplinary specialists. I had to go and get body work and see manual therapists to help release strain and tension in some of their musculature and fascia. We had to work with dentists and do expansion and do things that were going to help facilitate the structural capacity for them to sustain all the functional work that we were doing in myofunctional therapy. So while it is absolutely wonderful, it is just one component of a greater puzzle that is going to help. And so I think those are the two biggest ones. It's not just a set of exercises, and it's not like a end all solution to a whole bunch of problems.
And it's not a magic wand, as you said, you know, it's not like, oh, let me wave it and it's going to fix everything. It's ongoing. There's other providers you have to see, which leads me to our next, as you were mentioning that, I was like, oh, I wonder, what do you see the role of or how do you see the role of collaboration between special providers like you, myofunctional therapists, and providers like me, dentists or MDs, or the tribe that we need around us to be able to treat our patients? How do you see that role evolving in the next 3 to 5 years?
I'm so excited about where the field is right now and what the trajectory looks like in the next 3 to 5 years. I see a lot bigger platforms that this is talked about. Right now, while we are getting more public awareness, myofunctional therapy, airway, like none of this is something that is common and talked about in all homes. You know, we could mention the word yoga on the street, and if we did it Family Feud style, 100 people would know exactly what you're talking about. If we
Yeah.
mention myofunctional therapy or airway disorders, like you'd be lucky if you get one or two that understand what you're talking about. And so I see in 3 to 5 years there's going to be this wonderful trajectory of it being brought to the forefront in a greater healthcare setting, being at conferences and being a topic where people are really understanding the importance of function and the importance of structure in the greater global scheme of things. The more that I hear people talking about people being a whole individual, the more excited I am about that type of collaboration, because we're so kind of squared off in these different little corners. Like you have a doctor for your eyes, you have a doctor for your heart, you have a doctor for your teeth, and everything is just kind of separate. But the more we really talk to each other, we're really helping the whole person. And so I am very excited to believe that we're going in the right trajectory to where this is going to be a super common thing. And a few years from now, you say airway and people will know exactly what you're talking about.
Absolutely. I cannot wait for that. It's been long overdue. And especially with Myo, you know, I think people, even whatever awareness is out there, people think, oh, you do myofunctional therapy if you have a tongue tie. And like, that's it. Go get some sessions before, do the release and whatever. And it's like, no, there is more. Yeah, tongue ties are there, but TMD, all of my TMD patients get to see a myofunctional therapist. All of my adult sleep apnea patients get to see my myofunctional therapist. It goes on, like, just there's so much that you can help our patients with, which brings me to the question, what are some of the signs that are missed? Like, you know, when we're doing exams as providers, or even for parents that may not have the knowledge or the understanding, like what are some of the common signs and symptoms that you see are being missed that we really need to bring awareness to? Remember, you know, we have, and as we were chatting earlier before we hit record, this podcast was started as a resource for parents, just because I had parents come every day to the practice, go, Where can I get more information? Who can I ask? What book should I read? And I said, well, we're going to do it for the parents. And then, of course, then I now have globally providers tuning in to listen as well. And I know none of us have all the answers to everything, but together we are more than the sum of our individual parts. So I'm sure we can all learn from what are we missing or what can we look for additionally that can help us, our sleep, but also our children.
Yeah. So, from a parent perspective, I think when you're looking at such a large set of symptoms, it winds up becoming overwhelming. So, I would say the biggest things that you want to look out for are like the things that are going to impact their day to day. So, while you could be looking for, crowded teeth and like some of the things that your provider also might be looking for, I think as a parent, just being really alert and attuned to your child's attentiveness, their impulse control, their tiredness or their daytime fatigue, if they have any. Sometimes tired kids don't look like tired adults. So tired kids might be hyperactive and very wired and
Bouncing
amped
off
up.
the walls, yes.
Exactly, as opposed to that fatigue. So being attuned to like these things that you would notice in the house. Not every parent is staying on top of how their children are sleeping, but you see them during the daytime. And so if you're seeing some of those things, those are like some of the bigger red flags. As an adult, some of these things that are unresolved in your youth, they compound as you age. So when you talk about the TMJ disorders, that's a big, big thing. All of that dysfunction that was there from when you were young, all that clenching and the grinding, and all of that moves forward as you get older to become a TMJ disorder. Or you might just be experiencing now yourself all of the daytime fatigue. You might have bigger issues with your blood pressure and being able to regulate that. You might have issues with, I don't want to say it's like full blown diabetes, but being able to really manage and regulate your glucose is a subsequent factor of not having that adequate function. You may see that you are just experiencing a difference in how you are appearing, right? So some of your muscles may start to not really appear as firm and plump as you would want your face to look when you're in your 20s and your 30s. You might feel like, oh, am I aging really fast? That might be something for you to start thinking about. So some of the more subtle things that I think we don't talk about as often as professionals, but that people really are looking for. I think these are the things that I would say are like the big things to look for as a parent. But as a provider, or as a parent or an individual, I'm sorry, but as a provider, what I think most people aren't looking for, but that they're seeing all the time, especially in dentistry, are things like periodontal disease. There is a biomechanic component of periodontal disease, and we talk about the biochemistry all the time. We're always talking about oral hygiene and brushing and flossing, but what about the function? If you're lacking tongue function or adequate salivary control or management, you are going to struggle with periodontal disease. Some of the clenching, grinding, parafunctional habits are wearing down and creating vertical defects in the bone, and then that is contributing. So like when you see periodontal disease, I want you to start thinking about airway. When you're seeing that you can't look straight back into a person's throat, like all you're seeing is what looks like one really long soft palate, that should be like super red flag. Why can't I see their tonsils? So when you're looking at these things that you would see every day, don't dismiss it as like poor oral hygiene or something to kind of throw off to an ENT or just dismiss altogether. Start thinking about it from a different perspective because it all comes together.
Yeah, I love it because we all have those patients, right? Who swear up and down and sideways that they brush and floss every day, that, you really go, I kind of believe you, but your numbers tell me a different story.
Yeah.
And you're like, off you go to my specialist, which is not a bad idea, but hey, maybe we need to look into function as well. I love that. See, I told you I was going to learn something today. Amazing. Love it. On the topic of learning, how can we learn more about myofunctional therapy? I know you offer a course, is that correct?
I do. I do. So I have a couple of ways to learn about myofunctional therapy. So one, I really, really believe that it is something that we need to be talking about more just as a profession. And
Mhm.
so for dental professionals, I have a free Facebook group. I go live every single week, and there's a library of nearly 50 lectures where I'm talking about all things myo from all different perspectives and how you can really go about it. And that's the Myo community on Facebook. And, that's open and free to anybody. If you want to step more into myo and get into like actually becoming a myofunctional therapist, being a provider, I have a course called Myo Pathway. Myo Pathway is an AGD PACE 28 CE course that will really like jumpstart you into a wonderful trajectory in myofunctional therapy. It's super comprehensive. I don't like to call it an introductory course because it goes so far beyond that, talking about a lot of different concepts that we don't really get to really dive into in what would be considered introductory level. So,
And that is something for dentists and hygienists. Is that correct?
correct.
Okay. Do you have a cohort starting soon?
I don't have cohorts, so it's actually open
Ongoing.
enrollment.
Oh, that's
Yeah.
perfect. The people don't have to wait for a start date. That is amazing. Would you mind sharing your website? And we will drop all of Karese's websites, ways to contact her, her social media links, the link to the course to sign up in the show notes. So don't be worrying about scrambling to write it down. But if you wouldn't mind sharing it on here, Karese, as people are listening.
Absolutely. If you go to Myo Pathway, so myopathway.com, you'll find links to the course itself and information about the course and to the Facebook group for the free education.
Perfect. This was for our healthcare providers. This is for our dentists or hygienists. What about the resource that you have for parents, the book? Tell me about that.
So I wrote Accomplished as like a labor of love. I tell my story about me and my son and our journey. And I tell a little bit about my girls. I always say my girls probably think I don't love them as much as my son because I'm always talking about him. But his story was really what made the
Started
light
this
bulb
journey.
go
Yeah.
off. And so that's in there. I talk about why it all really matters and why what you may have been thinking about when you think about sleep, because when everybody thinks about sleep, even when you Google sleep, it's going to tell you you need a certain mattress, you need a certain pillow, you have to have a certain temperature, you have to whatever. And that's not to discount all that. But if you do all of that, and you're not breathing right, it's not going to make a difference. And so it's really highlighting the connection between breath and sleep and how we can really optimize the two. There's a wonderful process in there. I call it my care process. It's an acronym CARE. And so it's a 4-step process that you can really use to start today to up level your sleep. So Accomplished, I'm very, very proud of that book. It's a phenomenal resource on Amazon. If you're looking for additional resources too, I have a blog, airwaymatters.blog, blog, not .com, but airwaymatters.blog has a wonderful list of resources and a wealth of information and blog posts about Airway and how you can really help yourself.
That's amazing. Thank you so much for everything you have done and are continuing to do for all of our patients and even the community, the dental community, because God knows we need more of everybody spreading the word. So thank you. I truly, truly appreciate everything you do.
Thank you.
Before we wind up our episode, I usually ask all our guests, and I think I would love to hear your answers. What are your top 3 tips for our listeners, be it doctors, be it parents, when it comes to Myo? What are your top 3 tips?
Number one is get started on nasal hygiene like right away. If you're finding that your nasal hygiene routine isn't making much of a difference, then it's probably a good time to reach out for a myofunctional therapist just to see what else kind of explore. Number two is to always advocate for yourself. You'll find that if you go and you talk to certain providers, not everybody knows what myofunctional therapy is. And some people might think it's a bunch of like hogwash or whatever the terminology may be for something they don't really believe in. And so they might not send you in that direction, but myofunctional therapy is a wonderful resource. It's not always everyone's first step. Some people need to go to other providers first. And I think most myofunctional therapists worth their weight in gold are going to have a good network that they can kind of direct people to. So if you're not being pushed in the direction of myofunctional therapy, just keep advocating for yourself until you find somebody who's going to listen to you and they'll send you in that direction. And my last tip, I think, would be just understanding that it is a process. It's not something that happens overnight. I like to compare it to personal training. Like everybody understands conceptually muscles from the shoulders down, and we're in the new year, everybody's working on their bodies now, right? Nobody's
Yeah.
expecting their body to have, six-pack abs and changes overnight. Don't expect that in the muscles above the shoulders. It doesn't happen overnight either. So temper your expectations.
Wise words indeed. Thank you so much for your time today. I know this is going to be a very valuable resource to anybody that tunes in. As I promised, we will have all of Karese's contact information, her website, the title to her book, the link to her book in our show notes, and reach out to her. I know she is super active on Instagram. Let's share your Instagram handle. That's how I always chat with you before we sign out.
Thank you. I am at the Myo Spot, TheMyoSpot.
Follow her if you aren't already. And like I said, tap into the amazing resource that she is. You deserve the healthy sleep. Your family does too. So here's to healthy sleep, my friends. I will see everybody next time. Thank you, Karese.